Okay, now we're going to talk about sprains and strains. A sprain is tearing or overstretching of a ligament that follows a sharp twist, and then a strain is a tearing or overstretching of a tendon. So the difference between these two is a sprain is in the ligament, and a strain is the tearing or overstretching of a tendon. So the etiology of these is just trauma or excessive use. These most often occur in the knees and ankles. They can happen in other joints of the body. Signs and symptoms, you've all seen these, probably had them. It's just that black and blue, swollen, painful, and a lot of the times you'll lose mobility or movement in those because of the pain. Diagnostic is a visual exam and medical history. Most often if you look back at what you've been doing, you'll be able to pinpoint exactly when this happened. The treatment for this is rest, ice, compression, and elevation, that RICE acronym. Also, you can use pain medications and analgesics. You're also going to want to immobilize this and stay off it as much as you can. Prevention is warming up before you exercise and to follow the safety precautions.